hernia being a common problem, and that too when it affects the female gender, that is the women, then what are the concerns and is the management different from when it happens in a male person? I am Dr. Kona Lakshmi, Minimal Access Bariatric GI and Robotic Surgeon, Yashoda Hospitals, Hyderabad. So female hernia is a specialized subject because for a female, when the hernia happens, as the hernia needs a definitive repair where we have to put in a mesh. But for female, there are different phases of life when there is lot of changes in the abdominal wall musculature, especially during pregnancies. So if there is a lady who has a hernia and which is not very big and has not completed her family, then we would ask them to wait and complete their family before they go for a definitive hernia repair. What if that same lady is having a hernia which is troubling her a lot, but she has not completed the family? In that case, we do what we call an anatomical repair. Means we only suture the defect without putting a mesh, again wait for her to complete her family and then come back for hernia repair. And also there are specific hernias like the femoral hernias, what we see more in females. Now femoral hernia can end up as a surgical emergency. So if any lady has a femoral hernia, irrespective of whether you are a child or a young lady or a past beyond middle age, you should get your hernia repair done as early as possible. But if you have not completed your childbearing, then that hernia will be treated with sutures. But if you completed your family, then it needs a mesh repair. With minimal access and robotic techniques available, most of the hernias can be dealt with small cuts. So the pain or the trouble from having a major surgical cut is almost not there, and you can get back to your activities as early as possible. So if you have swelling in the abdomen which is diagnosed as hernia, contact a specialist, take appropriate opinion and get the appropriate surgery done. Thank you.
Like, comment and subscribe for more health updates.